Nateglinide is a meglitinide used to treat non-insulin dependent diabetes mellitus. In this video, let's found. What is nateglinide? What is nateglinide used for? Contraindication. What are the side effects of taking nateglinide? How does nateglinide work? How to use nateglinide? What is nateglinide? Nateglinide is a drug for the treatment of type 2 diabetes. Nateglinide was developed by Ajinomoto, a Japanese company, and sold by the Swiss pharmaceutical company Novartis. Nateglinide belongs to the meglitinide class of blood glucose-lowering drugs. What is nateglinide used for? For the treatment of non-insulin-dependent diabetes mellitus in conjunction with diet and exercise. Contraindication. Nateglinide is contraindicated in patients who have known hypersensitivity to the compound or any ingredient in the formulation, are affected with type 1, namely insulin-dependent diabetes mellitus, are in diabetic ketoacidosis. Side effects. Common side effects include headache, nasal congestion, runny nose, joint aches, back pain, constipation, cough, flu-like symptoms. Pharmacodynamic. Insulin secretion by pancreatic beta cells is partly controlled by cellular membrane potential. Membrane potential is regulated through an inverse relationship between the activity of cell membrane ADP-sensitive potassium channels, ABCC8, and extracellular glucose concentrations. Extracellular glucose enters the cell via GLUT2, SLC2A2, transporters. Once inside the cell, glucose is metabolized to produce ADP. High concentrations of ADP inhibit ADP-sensitive potassium channels, causing membrane depolarization. When extracellular glucose concentrations are low, ADP-sensitive potassium channels open, causing membrane repolarization. High glucose concentrations cause ADP-sensitive potassium channels to close, resulting in membrane depolarization and opening of L-type calcium channels. The influx of calcium ions stimulates calcium-dependent exocytosis of insulin granules. Nateglinide increases insulin release by inhibiting ADP-sensitive potassium channels in a glucose-dependent manner. Mechanism of action. Nateglinide activity is dependent on the presence functioning beta cells and glucose. In contrast to sulfonylurea insulin secretagogues, nateglinide has no effect on insulin release in the absence of glucose. Rather, it potentiates the effect of extracellular glucose on ADP-sensitive potassium channel and has little effect on insulin levels between meals and overnight. As such, nateglinide is more effective at reducing postprandial blood glucose levels than fasting blood glucose levels and requires a longer duration of therapy, approximately 1 month, before decreases in fasting blood glucose are observed. The insulinotropic effects of nateglinide are highest at intermediate glucose levels, 3 to 10 millimoles per liter, and it does not increase insulin release already stimulated by high glucose concentrations, greater than 15 millimoles per liter. Nateglinide appears to be selective for pancreatic beta cells and does not appear to affect skeletal or cardiac muscle or thyroid tissue. Half-life: 1.5 hours. Dose: Type 2 DM monotherapy, or with metformin. 120 mg POQ8HR. 60 mg POQ8HR if patient near goal HbA1c. Take dose 1 to 30 minutes before meal. Limitations of use. Not for use in patients with type 1 diabetes mellitus or for the treatment of diabetic ketoacidosis. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about nateglinide we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.